Okay, so now we're going to go over a special test of the knee. The first ones I'm going to show you are your varus and valgus tests. So for these particular tests, we're testing the medial and lateral collateral ligaments of the knee. So the outside stabilizers, remember these are extracapsular ligaments, so they're located on the outside. They actually blend and become part of the joint capsule itself. The ACL and the PCL, your cruciate ligaments, those are intracapsular, so they're inside the capsule itself, holding the bones together as they cross in the middle. So, in order to do a valgus stress test, when we want to test the MCL ligament, what you'll want to do is have your patient relax their leg, which is sometimes really hard, especially after an injury if there's some muscle guarding. Oftentimes they won't relax very well. So what I like to do is, you can, especially if their leg's a little bit heavier, you can cradle it in your arm like this to show them that you have the leg, that there's good support here. I kind of like to passively wiggle it around a bit until I know, by feeling with my other hand, that their hamstrings are nice and loose. And then with the heel of my hand here, I place that over the lateral aspect of the knee, and then I'm going to push with that one, as in giving a lateral force, or valgus force, and I'm going to pull with this hand down here, the foot towards me, very gently, with the knee at 0 degrees of extension. Now sometimes, and some of your lab instructors might have shown you this, you can also test the knee, especially for the MCL ligament, at about 30 degrees. So in that case, you put a slight bend in the knee, just a slight one, and test it in that position. Sometimes, just for me personally, I like to get it at 30 first, so I can actually kind of feel a little bit of give and movement in there, and then I lock it out at 0 and feel it. Now remember, with the person that you're going to be testing, hopefully has a healthy knee, and so you're not going to get very much movement at all. Remember, we talked about in class, as soon as you're in that 0 degrees of extension, you're in that screw home mechanism, and the knee is very, very, very stable there. So it's only if you actually have ligament damage that you're going to get an opening of the joint, and it will be very obvious when you get that. And then usually, if it's not completely torn, it will be painful with that laxity. So that's the valgus stress test, because I was applying valgus force. For the varus stress test, you can test it from this position. It's a little bit more awkward, as you have to stabilize and pull and push in the opposite direction. So honestly, especially since I'm smaller, I like to switch sides. So, and it is still awkward because they're here on the table. I can either sit on the table if I want, or I can ask the subject to slide off a little ways so I can still stand and do it. But since I want to make sure we're in the frame, I'll just sit on the table and do it. So, same idea behind this test. We're going to cradle the leg here, make sure that they're nice and relaxed. You're going to take your right hand, put it on the medial side of the knee here, and once you have them at 0, you're going to apply that force in a varus manner, so in the medial aspect, while pulling the ankle towards you. And so again, we are at 0 degrees. We're not going to get very much movement, so in this case, this would be a healthy knee. So then now we're going to do the cruciate ligaments, so the ACL and the PCL. So for this, I'm going to show you the anterior drawer first. And when you think about the anterior drawer, it's very similar to the concept that we went over at the ankle with the anterior drawer. Okay? So we want to try and slide this tibia forward because the tibia in an ACL injury translates too far forward or anteriorly. So the ACL resists that anterior translation of the tibia. So with this test, you'll want to position your patient so they're supine, lay down, relax. You put their foot up on the table so their knee is about at a 90-degree angle, and then you want to stabilize that foot by actually sitting on it. Then you're going to want to put your thumbs right into that joint line just as you did before during your palpations. Get your fingers right here behind the knee at the tibia, and then making sure, and this is good too because if you push up with your fingers here at the back of the knee, you can really tell if their hamstrings are relaxed or not. Remember, they can have a significant amount of guarding. Some people have a really hard time relaxing during tests like this. So make sure that they're nice and relaxed. And then you want to pull forward on that tibia. And again, with a healthy knee, you should not get very much translation here. With some people, they are a little bit more relaxed than others, so you might see a little bit of a translation. That's not abnormal. What would be abnormal is if you compared it bilaterally and there was a significant amount more translation. If you want to test the PCL in this position, you can as well. And so how you would do that is you would just do the opposite and actually do a posterior push on the knee. This is a very, very stable, very strong ligament, so you very rarely get any type of translation here. So that's your anterior drawer. Just to show you an example, Tyson actually is missing his ACL in his left leg. So if I were to come bilaterally, ask him to relax his hamstrings, and then test this over here on his left limb, I get much more translation, which you might not be able to pick up from the view of the camera there, from how far away we are, but I can feel definitely much more translation of his tibia than I did on his other leg. Some people will open up a ton. He has some pretty strong hamstrings and quadricep musculature, so his knee is really stable. So even with him, it's kind of difficult to get that positive drawer. The last one I have two more to show you. The Lachman's is another ACL test that we do. So for this one, same concept. This just gets the leg into an even more relaxed position. So you really have to make sure for Lachman's that they're completely relaxed, or you're going to have a really difficult time getting this, because it is a pretty difficult test to really master. But the whole key is that you need to stabilize the femur, so make sure that the femur stays in position while you slide your other hand underneath the tibia here. You kind of want your thumb to be around where the tibial tuberosity is. And then you want to try and grab onto that tibia and translate it up. Oftentimes, it doesn't take much, especially if they've torn their ACL, to get that translation. But you kind of think of it as you're kind of pulling it up and kind of anterior, well, it is anteriorly, but your hand movement's almost kind of tilting like this, if that makes sense, which I hope it does. People with small hands, like me, testing big legs like this or even bigger, it is awesome if you can have some sort of a bolster with you and you can stick the bolster underneath the femur here. And this just helps get it in a nice stabilized position where it's nice and relaxed, and you don't have to spend as much energy or your musculature trying to hold that leg up or keeping it stable. And so now I have a much better grip here on this tibia, and I can try and translate it a little bit better. If you don't have a bolster with you, one of the things that you can do is you can get your leg up under here, like so, have them rest on the leg there, stabilize, grab hold of the tibia, and translate it forward. Okay? The last one I'm going to show you is going to be the posterior sag test. So this is another test for the PCL ligament. So what you want to do, especially if someone is much larger than you, kind of ask them to help you out a little bit. Get their legs up here on the table like this. And then you're going to want to lift here at the heels, support, 90-degree flexion at the hip, 90-degree flexion here at the knee. And you want to see the leg you suspect has a PCL injury, you want to look at it from the lateral side. So we'd be looking at the right leg here. And what you should see is compared to the other limb, this tibia would drop significantly lower than this one, which would indicate that they have a PCL injury, as the PCL prevents posterior translation of the tibia. So, again, when you guys are going through your special tests, just try to remember exactly what those structures are preventing. And if we suspect an injury, we essentially are just trying to recreate that injury. So if we suspect that they've hurt their MCL, we want to test it by essentially recreating the injury that would have injured it in the first place. So good luck. If you have any questions, you can shoot me an email. But have fun and get lots of practice in.